So with that, we have the topic is how do we go forward? You've heard some perspectives from three of our industry colleagues, and I'd like to give the opportunity for others to take it from there. Perhaps starting I don't want to put people on the spot if they're not prepared to say anything. So why don't we have people to comment on what they think the next steps forward are from an industry perspective. We've heard that the market isn't there, but it's certainly potential. And how do we move forward? Any thoughts on that, just in general? Please go ahead.
Can you hear me? Yeah. Couldn't agree more with the comments that were shared by the previous three speakers. I think we've crossed the threshold of demonstrating that it's efficacious. I think there's a lot of data showing that it's safe. What we're hearing from customers and dealers is we have to get the cost down, price per square foot, equivalency with some kind of metric that we can all share and compare apples to apples when we talk about disinfecting our public spaces or schools or hospitals. Some people use air exchange rates. Some people use the output, but it's really difficult to compare whether it's between far UV manufacturers or products and then all the other choices that are out there. So cost and standardization of some kind of metric. We like to think of far UV as it should become a utility. It should be thought of just like an electric appliance, an HVAC system. And I think if we can get people to think about this as just another tool that should be deployed, and that's the long-term thinking. And yeah, the stigma that was brought up before. I think we all have to work really hard to get people to stop. I like the concept of not calling it UVC and calling it far UV or something completely different. But yeah, that's what I would say.
Thank you. Why don't we stick with this perception for a moment? I personally think that the dangers and the perception of UVC as being dangerous is far, far overplayed. And because, and it really riles me to see every 222, or not every, but some 222 talks start off with, we can't use 254. We have used 254 for almost 100 years quite safely, and almost all the injuries are accidental injuries. And because it's in the upper room, a lot of the questions we are raising around 222 are really not concerns, because we're not intentionally exposing people. But anyway, I think, PJ, would you talk? I mean, we've talked, and we put in 222 into this bar in Boston, piano bar, and in the Pine Street Inn, the same place that had the original UVC, and there hasn't been a whisper of concern, not anybody. We have a tent on the tables that say what's happening. There have been nothing. We put it into a UV upper room into the Cambridge Friends School. Bill was involved in that. We had to deal with some MIT parents, but we got past that, and they're thrilled. So there is certainly, you can be overexposed to UVC. We're talking about eye irritation, and so what do you think, PJ?
Perception. Is this on? Can you hear me?
Yes.
Okay. So if there was one thing I was going to say today, it's that perception issue. I think there's a few misperceptions that a lot of times we get caught up with One of them is that we have this big story to tell to get people comfortable using UV, to get people comfortable using Far-UVC. We don't see that at all. We've got 4, 6, 10,000 installations. Let me give you an example. 60 schools put this in, 33,000 students, 96,000 people that they go home to, their families. And put it in, you know, did a lot of education to make sure everybody knew what it was doing. They were very thankful, especially in a very impoverished area, to get the same technology that we were using in the Pentagon, right? But here we are a year later. We have the results, you know, some of the results back, you know, 27% reduction in absenteeism metrics, things like that. And my question to the administrators there was, well, what kind of feedback did you get? Did you get, you know, your normal complaints? They said, no. They said, well, somebody had to complain. It's a school. Somebody had to complain about something, right? Nothing. Over 100,000 people involved, and not one concern over safety in that. So, and the other part of this perception is interesting too, because when we came into this, we were more researchers, right? We started looking at this with Boeing in 2016, got all excited, but there were no manufacturers back then. I mean, there were manufacturers of bulbs, thank goodness, right? Otherwise, we couldn't have done some of the stuff that we did. However, when we needed funding, because you have to survive, we were researchers at that time. So we put in grants to NASA and the Department of Defense and whatnot, and we lived on that. So in that way, we kind of have a little bit of a synergy with the academic community that also lives on some of that funding. And part of what we did when we wrote those proposals was saying a little bit of what you referred to. Hey, 222, now you can get UVC safely, right? And I remember talking with David Sliney and Ed, and one of the first things they said is, please do not throw 254 under the bus. Do whatever you're going to talk about on that, but the perception is so key, and I think they're absolutely right that if they hear 254 bad, everything after that is blah, 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 blah. It's UV bad, and you're taking yourself down too. And what's interesting is I see it playing again a little bit now as we're looking at ozone and secondary chemistry. It's almost like the papers that are being written, the titles aren't being written by the people who are writing the papers. It's like it gets handed off to somebody, and then there's a little bit more sensationalism. We fought an article that was written in 2006 for years, and it's still brought up as, oh, here's the evidence. It's an issue, right? 222 is bad. Look, it says they're right in this thing. And now all I've been thinking over the last 2 months, I have 3 more papers that the only way we're going to get past that is if we get those authors to understand that there's a weighting, a balanced approach, and to understand, work with them. Please talk to us. If we can help you with anything, we want to. And we've been doing this for a while. And thank goodness we could stand on the shoulders of the upper room guys. Couldn't agree more.
I think just to build on what PJ, what you're saying, perception is key, but also general awareness. So obviously the people in this room are experts, understand it, but the general public does not. So when you say you've got this new technology, you can utilize it, it's human safe. People say, what? It's almost too good, sounds too good to be true. And so I think that's been a major issue too. They're like, if this exists, why have we all been sitting in our living rooms for the last 3 years? So there's kind of a little bit of that as well. So.
Yeah, you know, I've been mentioned to several people that, and this is coming from a physician, not anybody who knows anything about business, but for years we were told eggs were bad for you. And then industry got together and created an ad campaign, The Incredible Edible Egg. And suddenly we don't think of eggs as bad for you anymore. And the same is true with the milk industry, Got Milk. And I think we need a UV industry campaign to say not all UV is bad. And it's not a difficult concept, really. I mean, we're only talking about that there's different kinds of UV, And I don't know, I don't think we have to divorce ourselves, as PJ said, from the other forms of UV, which will remain useful. And but we need to clarify the message, and you know, it's not that difficult. Someone else.
Yeah, just to add to the complexity. So I'm almost 40 years in the lighting business. And when I got into GUV, my God, and now with Far-UV, it's the most complex business and science that I have ever been in. We have not only the germicidal reduction, but the safety and regulatory, and now ozone on top, and VOCs on top, and new questions coming up. Just among us, I mean, I don't think anyone in this room can understand and argue all the fields that we are dealing with. Everyone is, but we still have to communicate and explain to each other that it is safe. Yeah, and so we have to find ways, not only among us, how do we find more or less simple words and the trust that what we are saying is really true, or that we communicate what we know and what we don't know. But then it's almost dizzying. How do we explain that to someone out there that you have to start what is light, and then convince them and build the trust. So altogether, we still have a lot to do. And of course, it's always difficult if you have someone new coming in with a totally different perspective, different experiences. How do you merge that? And I can only say talking, learning from each other, and especially building trust is a key part of our future here.
Yes. Go ahead.
Yeah, I support all that's been said here. I think there's this sort of common theme. And a little anecdote, I spent, prior to entering this industry, I was a 30-year Honeywell veteran. So I know everything about building automation and air conditioning. And the one sort of maxim that you know, it comes very early in your career is people don't notice air conditioning until it's broken. And I was so jealous of the guys who were selling elevators because it's an experience. It defines the building, and there's a very, very it's a very close linkage to that, and your ability to do business, your ability to get revenue, get margin, and how do you define it? If I use that paradigm, the issue that we have with GUV and Far-UV in particular is that it's really hard to convince somebody that they need something that they've never needed before. And we've got to be, as an industry, really clear about what this is. Remember, you can sell ice to an Eskimo. You're probably not going to sell it more than once or twice, and it's a lot of work. Okay, and you won't make money. Similarly, if we spend time as an industry convincing people who don't want to be convinced, that's going to be hard. We've got to be very, very clever about how we launch this industry, because you don't want to install something that makes people irrelevant, the technology irrelevant after a year. I thought that PJ's comments about the school and about what the benefits it brings was excellent. And I would just simply say there's 98 billion square feet of air-conditioned non-residential space in the US. Take 1% and you say these are the people who are the bleeding edge or the leading edge. There's always a rationale, let alone the really critical business resilience needs that government may need, statutory authorities. If you think about that, it's the argument that goes there is how many more dollars per square feet are you going to charge if we make this a safer environment for you? How do you prove that to your stakeholders? This is a complex dialogue. It's very subtle, and it has to be addressed very much like that egg campaign, like bottled water, crazy, you know? You convince, you demonstrate the business case and the argument for creating demand. It's all about demand and getting that informed demand and shaping the industry.
You put your finger on the fact that it's very difficult to to market prevention. It's hard to show what doesn't happen. And so you have to have some surrogates for showing that things work. You mentioned air conditioning, and another thing I've been saying for many years is that, you know, with global warming, air conditioning use is skyrocketing, particularly in developing countries like India. And when you put an air conditioner in a split system air conditioner, you have to close the windows. Suddenly, any air disinfection that existed is gone. So I think, you know, you folks should talk to the air conditioning people about marrying germicidal UV and air conditioning as a way to replace the air disinfection that happens when you close the windows, which is happening. Yeah.
Thanks, Ed. I'm John Yerger, not Sungjin Park. You probably figured that out, but I'm CEO of Eden Park. Like PJ and Ryan and Holger and everybody here, I've talked to hundreds and hundreds of people about this idea, and everybody I talk to has never heard of it before, and everybody says the same thing. Why the hell isn't this everywhere? This is obvious, and this is just regular folks. So people get it. The problem is we're all science-based, right? We make it complicated. I think we have to figure out, get together, form an industry alliance, collaborate, simplify, right? The milk thing was simple. You look at all these things that have changed perceptions, it's simplicity and clarity and unity that do it. Now, that does not mean, I want to be clear, does not mean we ignore these concerns and issues. We can't. We have to go address them. But we shouldn't be arguing just in public. We should figure that out together and come to a joint answer. So that's really my overall message.
Let's form ICFUST. Let's set up a marketing or a information department. Let's get money in the organization. Let's hire some people, and let's spread the news as a group or a team or an industry. I'm ready, and I hope all the other manufacturers are ready. Let's get it started. Let's not talk about it. Let's do it.
Another, I think, barrier to moving forward, and I won't be here for the regulatory discussions, unfortunately, but is the fact that we work in silos. There are people who, you know, with a hammer that everything looks like a nail, and we are subject to concerns about literally eye irritation versus saving lives, and we need some forum to come to agreement with regulators. What is a reasonable balance between safety and the public health objectives? Yes, go ahead.
So, John, I think you brought up a really good point that everybody in this room has been thinking about UVC, UV, far UV for a very long time. But the average person out there doesn't really understand it at all. They don't really associate necessarily UVC with anything bad. And yes, the work that we've done with potential customers and just understanding what the market looks like is a market that says, wow, that sounds great. But there is sensationalism in everything today. You know, hopefully the media wasn't here during our lively session yesterday morning. But the fact is there are benefits and there's risks in everything that we do. You're probably right. If you drink too much milk, there might be some risk, but we enjoy it. We enjoy eating eggs. We enjoy our omelets in the morning. We have to look at use cases. We have to look at the customers. We have to find better use cases and not just say that this is great for everything. It might be great for everything. And we are creating the science, we're creating the safety, we're creating the platform. But the platform has to be supported by paying customers. And we have to find out who those paying customers are and develop products for specific use cases where there's a customer that's willing to pay for it, that gets some, and I don't mean enjoyment out of a product that you know doesn't really do anything until you know that you've been saved, which is very hard to prove, to your point. So it's kind of a rhetorical statement that I'm making, and it's pretty obvious. And all of us are thinking about who those customers are going to be. We also have to find them. And once we find those customers and develop the product specifically for those use cases, you're going to have end results and outcomes that can be leveraged in a broader basis. That's the first thing I wanted to say. The second thing I wanted to follow up on is what John was talking about, is the fact that, yes, we walk into this room, all of us walked into this room assuming this room is safe. There's probably sprinkler systems that have been installed, but none of us in this room decided what sprinkler systems were going to be in here. And there was probably an architect someplace that figured that out based upon what the regulations were in the city of New York, based upon certain building codes. So when we're talking about integrating into HVAC systems, or we're talking about integrating into schools, we got to think about the regulatory bodies that are making decisions on our protection, whether they're right or they're wrong. Those are some of the customers that I think we have to talk to.
Is it possibly a stage solution? So if we have, if there are certain things where we know that you're comfortable with the ACHs being at a certain level right now, maybe we start with those first. So whether it's hospitals or office buildings that have the higher ACHs, and that we're saying we can all maybe come to an agreement and say, those ones are ready. We're comfortable with the technology being utilized there. If there's ones with lower ACHs, we're going to say, we're going to do a little more research, or we're going to get things set there. But maybe there's a solution where it's kind of a staged approach. We're saying, ready to go here, not quite ready here yet. So,
Well, we also need to get some really on-site measurements of what's really going on in real life settings to go along. In terms of demonstrating that something is happening in a room with germicidal UV, you can look at David Welsh and his team's poster upstairs about using film monitors, and it could go either way. But you for the customers that we have at Club Cafe, we put some of these on, and waiters and et cetera, and they see that something is happening. Within hours, this little thing turns color. Now, we assure them that that's actually showing that it's safe. We're well below any threshold limit value in terms of actual exposure, and that they're getting a germicidal dose in the breathing zone. So at least it's something that is better than saying, take my word for it. But anyway, other thoughts about the marketing issue, the bigger picture of marketing this technology. Yeah.
At the risk of being a little bit of a contrarian, I do like the concept of gathering far UV expertise in the room. That 5 years ago, we certainly didn't envision a room this big with the EPA and CDC and all our government partners here and academics here. But I think it's very important, and you alluded to it, that we have to be part of the bigger ecosystem. This is about clean air in indoor environments. That means we have to also get the ventilation, the filtration. We have to be part of the overall ecosystem and not pigeonhole ourselves too much in, oh, we're going to have our own standards, we're going to have this. No, we should be part of the bigger federal standards. And I think some of what we're achieving with 241 is heading that direction. I don't know if it's going to be perfect for far UV, but it is going to be helpful because it's starting to bring this all in together. I hope, right?
Wish there were a bit more mention of germicidal UV in it, but anyway. Other ideas on moving forward? Cost. Sure.
I'd like a quick comment on cost. There's two ways we could do this, right? One way is we could try to be maybe Tesla or something and sell it at a low price and get huge volumes, then hope eventually to make money. The other way is we find the niche opportunities where the benefit is gigantic. There are plenty of those. Our cost right now is easily paid for in societal benefit right now in many applications. Part of the challenge is the person paying isn't the person benefiting. Okay, but I think there's cost, and folks can talk about what's happening with cost. We're all trying to bring cost down, but we're not going to have a $20 product in 2 weeks. That's just not what's going on here. So I would say, and along with Jennifer said, let's focus on the places that really see the benefit. Let's install there. Let's get that result. Let's get that application and let's build. That's my comment.
Yes.
Yeah, I'd second that. At the end of the day, this is a hard world and your parents teach you, you know, what value is, and the perceived value has to be better than the cost. If you don't perceive the value, you're not going to pay. And I could not agree more with 2 points. The first one is focus on people with a need. The easiest way to get somebody to complain about something being worthless is to go and sell them a bill of goods that they don't want or they don't need. Focus on the places that have a real need and an acknowledgement of that need, and it becomes a lot less cost sensitive. I mean, this is just basic segmenting the market. And the second one, and I'd urge this forum to come together and get some guidelines, as Jennifer mentioned. Just tell me how many, you know, it's a real simple thing. Is it 3 air changes per hour? Generally will sort out the issue with ozone and particulate generation, or is it something else? Let's try to make it a little easier first as we explore this at the finer points. And I think making it easy for people to understand the value, implement it, feel comfortable is going to be key here. Cost factors into it.
Maybe we should think about also where to make inroads. And so healthcare is obvious, and many of you have already installed these. Perhaps schools, but you know, cost is a big issue because lots of area and volume. What about? Well, the restaurant industry is enormous, and I think that is a you know, if people love to market that, you know, my place is vapor or whatever. Where else? What other niches would be thinking of? Yes, Peter.
Mosquito, malaria.
We learned that's probably the fact that I most enjoyed learning about, that mosquitoes don't like. By the way, in terms of perception, we also have to tell people to choose their plants wisely. I was leaving the Napoleon room, and the owner said, "You know, your lights killed 2 sets of poinsettias," and that in fact was true. And I said, "Gee, I should have told you that this was going to happen." He didn't mind. He said, "I know that something's working," and we now have a plastic plant. But it's not a good thing to have people's plants die without knowing about it. Oh yeah, sure. Go ahead. Yeah.
Is it on? Thanks. Rob McCullough from Pathogen Reduction. I would think that there maybe, you know, we're asking the right questions. Is it safe? Is it effective? And as scientists, we answer those questions by doing skin exposure measurements and measuring kill rates and those kind of things. But when you're trying to push this into a business environment, they want to know the answers to the same questions, but they don't really care about science. When they want to know if it's effective, they want to know what the absentee rates drop is. They want to know if it's safe. They want to know if there's any incidence of skin cancer in their employees or their students or whatever. And I think the key to getting that acceptance is data. An example, PJ talked about having 100,000 students exposed to it, and you mentioned something like 27% drop in absentee rate. We should be collecting that data, putting it into a big database that's available and substantiated. So when an employer says, "Well, what good is it?" You go, "Well, we'll cut your employee absentee rate isn't by 25%. They can convert those numbers into dollars, and they can convert those numbers into savings. And so it's a different perspective. I think maybe we should start looking at it that way.
Another area that we may see this technology sooner than later is in the airline industry. Ralph, I went to a meeting of the American Aerospace Association, Medical Association, and there are plans to get in unoccupied spaces at first on airplanes down the aisle with sensors, bathrooms, And if people begin seeing this deployed when they travel, they may again begin to think of it.
Hi, I'm Terry Moore. Yes, we all believe in this technology, but there's an awareness problem out there. And that means that what we need is a strategy and a playbook that will tell us what targets to speak to and what language to use and what the timetable is. These are very clear business marketing questions. In order to approach that, what we need is a trade association. And I suggest that this group reorganize itself today into a trade association that can begin to do the market research that will give us the answers to these questions so that we can move. Something we can do today, Friday, the 16th of June. 2023.
David, over there.
Hey, this is Dan Spicer. It's actually really great timing because last week the IUVA, the International Ultraviolet Association, had a really big meeting, a great meeting down in Georgia. We met at the ASHRAE headquarters, and actually we ended up breaking into 3 groups, and out of that came some really good work. I ended up leading a session dedicated to education, training, and certification and outreach. So that started last week. That process started last week. So I please all the OEMs here, all the manufacturers, come see me afterwards. Give me your email address. I'll get you on our list. We're starting with a case study showcase. So if you have good case studies, any good background on effective application of the technology, if it comes from an IUVA, if it comes from a group that is respected and trusted, it's been around for a long time, it's going to have a hell of a lot more weight than forming a brand new group today. And if it comes from the individual OEMs, no offense, you're probably biased, right? Of course you're biased. You want to make some sales. I understand that. But coming from a consortium, it's going to look much, much better. So please come see me afterwards, get on the list, give me your best case studies. And we're even going to try to do some awards and maybe a case study of the year kind of thing. So, and we'll dispense that information through the IEVA.
How do you translate those case studies into actual awareness?
So actually, not to hog the time here, but it's a multi-pronged approach. That's more for the architects, the mid-level folks. So we're going to also do very simple UV 101 type YouTube videos, and we're looking to identify influencers. And this is totally not the case just yet, but with people like Neil deGrasse Tyson or Bill Nye, having some influential, pop science people educate the general populace. And then the next step up, having these showcases, having these case studies, having the more nitty-gritty stuff for the mid-level folks who are helping to deploy the technology. So it's multi-pronged. Anyone wants to see what we came up with, we have a list of, I think, 5 bullet points. Some as simple as updating the IEVA website and making it more navigable. Thank you.
I'd like to suggest the immune compromised as a target. We have industry folks that are building the products. Most of the connections with the academic side relate to the medical side of things. I think you'll find a very receptive population that's very nervous about their health and safety as they are immune compromised from chemotherapy. And I think that the published impact of what you would have, because they are so sensitive, you're going to see a huge number change. And if there was a collective work towards that, and we all know people that have had chemo and have suffered through those consequences, I think that would be an area where everyone would be working towards the same thing.
My only concern there with the immunocompromised and transplants also we've been hearing about is that the sense is that they want it in the home. And my own feeling has been that this is probably not a technology that belongs in homes, but maybe I'm wrong. We have another one down here, David, when you're. Okay. Oh, go ahead. No, go ahead.
Hi, Samantha Moore from Moore MedTech. Peter, congratulations on your installations. That's really, really good news. I suppose from our perspective here in the UK, it'd be really helpful to have that central database where we can all share information. Clearly, as Robert suggested, we can get some non-competes, etc., in place to make it fair. But ultimately, we're all here to try to utilize a technology that can save lives. That's it. Yeah. How do we get that started today? And lastly, really disappointing about the poor sales technique from your competitors. I'm sorry to hear about that.
Steve Turkel is next.
I'm in the clinical practice of ophthalmology. I see sick people. Within the last 4 months, I've had 3 people, one walk off an airplane with COVID, swearing she'll never go on an airplane again without a mask, another with adenoviral conjunctivitis, and a third with URI. People get viral infections on airplanes all the time. The fact that we don't have, we've never been able to do something simple. 254 works, but it's hard to handle and it has a downside. But why it's not in airplanes is beyond me. A closed, protected environment where people pay a premium price to go for a short period of time, and for which there's a demonstrated viral infection. The other thing, from a doctor's point of view, being able to control viruses is fantastic. It's like antibiotics have come along. And I think the world of transplants and implants should be explored. Dental implants, crowns, they stuff. Dentists don't have sterile. They say we can't kill the viruses without damaging tissue. Limited antiviral compounds are present for very few of the viruses we deal with. So I would explore the medical aspects of this. And yes, anybody who's subject to viral infection is going to look at this, but certainly why it's not in airplanes is beyond me. I don't understand that.
So first
Thank
on
you.
this side and then Richard, and then we'll go to Paula.
First, after hearing all the great ideas, I kind of would advocate from my non-position for a layered approach where you're talking about this trade organization. I think that can move in a little bit of different space, but also the collaboration and the ideas that, from IUVA sound fantastic as well. But I think really a layered approach when you have this technology still awaiting utilization out in the public space and protecting this public air is going to be fantastic. And 2 quick questions. First one is for general awareness, when we have these installations, does anyone have any stickers outside these buildings, these spaces that says your air is protected by Far-UVC?
We do in the nightclub, on tables and on television screens. And
wonderful. I think having that, ubiquitously throughout, that's your standing advertising that people are going to be walking by all the time. It's like your billboards, and then it generates those conversations. So I think that would be a really simple, easy way to kind of get things going. And the last thing to really get out, to get in the open air is, have any of the manufacturers, has anyone thus far seen any of these signals related to any VOC or any ozone toxicity? I think that with the millions of people by now that have been under these lights, some of them in small buses, some of them in dental offices all day, every day, that it's important for us to actually talk about the real world. And I really like to know, because if we're having problems, we want to discuss them, we want to hear about them.
Probably nobody has done more UV installations than Paul Jensen. Have you seen or heard of any ozone complaints or anything like that? Not that it's
No.
Yeah. Okay. Yeah, Paula.
All right, I'll start off my remarks. Many people don't know I'm trained in chemistry. And about a dozen years ago, when I was in philanthropy, I started a program in indoor chemistry. So I know a lot of indoor chemistry. I also, but right now, my mission as a contributing scholar at the Johns Hopkins Center for Health Security is to sort of develop materials to promote policies for healthy indoor air. And a few people in the room, in this room, were at a meeting we hosted in Washington, D.C. last September. And when we selected the venue, we selected a venue that had good air exchange rate, good filtration. And then thanks to people like PJ Piper, and then at that time, his partner who was at Aeromed, we also installed, and again, I have no expertise in but PJ and who am I forgetting? Bill with consultation with Don Bilton, Bill Monfleth, installed these so we could showcase to people in DC what a layered approach would look like. People were happy to see fixtures. No one was afraid. But the point is that it just seems like there seems to be such fear of it. And again, I think this is a very important layer. I think it's an important arrow in the quiver. And I just really, again, I'm trying to be supportive as much as I can. So thank you.
We're approaching the end of this session, and I want to make sure that if there are anyone on the panel or in the audience that really needs to, Richard will include you for sure. Go ahead, please.
I think this is on the question of what to call this stuff down there in the Far-UVC. I think the most straightforward thing, I tried to promote this in our group in Columbia occasionally, we should just call it UVD. And it's very simple. It's completely logical. It fits in completely with the designations that have been made already. And it only means is to put a cut point at, I don't know, 235. UVC is from 235 to wherever it ends at what, 290 or something? And the UVD would be from 200 to 235.
I think the number of people who relate to UVC to danger is relatively small. They're enough knowledgeable about UV bands, but so I think the problem is the word UV. Sorry.
This is a different question of where to install these things to actually prove something. Reading in the New York Times a couple weeks ago about a Johns Hopkins program. It's called something like Zero TB in Tibetan kids. It has to do with boarding schools in Tibet where the incidence of tuberculosis is extraordinarily high. And it would be a place where benefits could be easily measured. The program has very good monitoring and has historical records of how it goes and what their medical interventions are. And it sounds to me like a place that would be an ideal installation to prove that this stuff works.
You remind us again that TB is the #1 infectious killer globally when we don't have a pandemic. Richard Vincent has been waiting there for a while. Then we'll come to you, Ralph and David.
As an architect by training, I always look to the building codes when I'm interested in looking at application. Right now, germicidal UV is being put within the building codes. There's been a work by the National Manufacturers Association here in the US. I don't know how it works internationally, but they are working to integrate germicidal products within building codes. And that's how things actually move in the real world. And then they get picked up by the architectural profession and they look at what are the standards. We're working in ASHRAE to integrate UV within ventilation standards and guidelines. And so that's the way really the people who are going to be professionally installing these systems will look to those sources of information. So if you can help in providing the information that we need to be able to develop the guidelines and the standards. There's a lot of standards that already apply to Far-UV as well as other forms of UVC. So there's a lot of infrastructure already in place. It's just connecting those dots and building those guidelines just like we're doing it for upper room UV as well as induct UV.
Rolf?
Yeah, I want to mention another layer which Dave Sliney, Paul Jensen, and I are working to provide with a grant through the University of Maryland. We are working with an organization called NALMCO, National Association of Lighting Maintenance Companies, to provide. They already have certification programs for lighting maintenance. We're trying to add a certification program for UV maintenance installation. Some of you guys know about this, and we will have a training program at the NALMCO meeting in October, but also a special one at the University of Maryland in August 15 and 16, and we're putting together a list of people. So this, because if the industry becomes successful, okay, installing, maintaining these things become critical because the manufacturers aren't going to do this, but somebody will have to.
Well, it is a barrier. People sometimes ask me, okay, you convinced me, I want to do this. How do I do it? And right now, there are probably a handful of consultants who are knowledgeable on the various approaches to germicidal UV to turn to the industry, and that's good, but it really should be independent of the product. Peter.
I just want to address the ozone issue. As I said earlier, we have several thousand fixtures out in the field. We even have maybe it's the highest concentration of UV lamps per square foot you will ever imagine. One of our key markets is the pharmaceutical industry, where they use our products in the clean rooms for fully gowned personnel. So we have a device that looks like a phone booth containing 155 lamps, and the operators go in there for 20 seconds to be decontaminated. They're fully gowned because their TLVs are high. And those of you who know the pharmaceutical industry know that they're not taking any chances, any risks. Our product has been validated, tested, certified, et cetera, et cetera. And even in a training room where they only have 3 air changes per hour, the ozone generation after 155 lamps in 20 seconds is far below detection level. In a fully 15 air changes per hour clean room going from B to C, the same, 0. And none of our installations anywhere have complained about ozone. I do not disagree with the research and the investigations that have been done in labs, but in real world, there's no issue. That was my last comment.
So last comment, Dave Sliney.
Yeah, I just wanted to point out, I've always worked under the umbrella of preventive medicine and environmental health. And we've all heard the expression, an ounce of prevention is a pound of cure, but most people don't really follow that. But we need to explain to the average layman that this is health insurance. This is a type of health insurance. You spend money, most people want to have health insurance. And whether if you put it in a building, you tell the occupants, we're giving you some free health insurance.
So the entire world has had an experience of airborne infection, and so we don't have to really work too hard to explain what that's like. So it's a great opportunity in that regard following this pandemic to make our case. I think we're at the coffee break now.
Can I know we're breaking, but I just think as a disruptive new technology that you are all responsible for, I think we should keep dreaming too. Obviously, overhead aerosol is key, but this could be repurposed in so many different ways too, whether it's for surfaces, in vehicles. We've all been in a lot of Ubers over the last few days where we're not sure who was coughing in the back seat, medical devices, as you mentioned. What if in this room where we couldn't install it, there were drones flying around throughout the last 3 days that were, so I think there's a lot of opportunity to dream. Probably gives heart palpitations when I say something like that to some of these people in the room, but there's a lot of opportunity to dream and really utilize this technology in amazing ways moving forward.
We have one more hand up. I don't know if we can get a microphone over there in the middle. Yeah, we're done. Just this last comment, I think we'll hate to.
Thank you for your chance I would like to inform you about the achievement and the facts in Japan from September 2020 to March 2023. Over 6,200 Far-UVC lamps have been installed in Japan. And it estimates that approximately 3.7 million people have been exposed to the 222 nanometer Far-UVC radiation. But no significant health risk have been reported. It's a fact. Yeah. And of course, care 222 preliminarily induced in the medical institute. The institute, the installation facility include pediatrical departments, children's hospitals, school, child welfare office, and other children-related facilities. Yeah, it's a big evidence. Yeah.
Thank you very much. And with that, we will go to coffee. Thank you very much.